partner group present. I would also like to recognize the presence of directors and senior representatives from the public sector. We have the Ministry of Health, but we also have the HRH and other government agencies, heads present here this morning, both from Tanzania mainland and from Zanzibar. I would also like to recognize the presence of heads of non-state actors in the health sector. We have our varied sponsors who've made this summit a great success. I would like to sincerely thank you and recognize your presence. I will mention your names later, but I would also like to recognize all medical practitioners present. We are here because you're here. Thank you so much. Mkapa Fellows present. We recognize your presence and your work across the health sector. I would also like to recognize the presence of our distinguished panelists present, but as well as the exhibitors. Honorable Minister, I think you'll have the opportunity to visit the booth later on today or tomorrow and see the work that our exhibitors are exhibiting outside. Tremendous work. Community health workers present, BMF staff, invited guests, online participants. We have very many online participants present, members of the press, ladies and gentlemen. Jamhuri ya Muungano wa Tanzania. Jamhuri ya Muungano wa Tanzania. I would like to welcome you all to the third Mkapa Legacy Summit. Honorable guest of honor this morning, and especially to this two-day pre-summit on National Human Resources for Health conference. The Mkapa Legacy Summit 2024 intends to mirror on taking local sustainability into new horizons, which, among many other objectives, we want to share evidence-based best practices of the human resources for health from a very wider spectrum. This is why we have people in the public sector, people in the private sector, but as well people from the non-state actors. Honorable guests of honor, without further ado, allow me to bring to the stage Dr. Ellen Mkondia for welcoming remarks, after which she will invite you to address this Congress. Karibu sana. As she comes, can we put our hands together for her? Karibu sana.
Thank you very much. Good morning, everyone. Our Honorable Minister for Health, Honorable Umi Mwalimu. I'd like to recognize the Deputy Permanent Secretary of Foreign Affairs and East Africa Cooperation, Ambassador Saidi Shaib Musa. Respective representatives from President's Office, Regional Administration, Local Government, as well as those representing the Director, the Permanent Secretary of Ministry of Health, our Honorable Chair of the Board, Dr. Adeline Kimambo, Excellency Ambassadors who are present here today, and representatives from the development partners, representatives from the non-state actors, our colleagues from academia, health workers present here today, invited guests, ladies and gentlemen. On behalf of the Board of Trustees and management of the Benjamin William Mkapa Foundation, I sincerely welcome you all to the second National HRH Conference, which has been organized by the Mkapa Foundation in very close collaboration with the government of the United Republic of Tanzania. I wish to thank each one of you for creating your time to be here today, and more so, very specifically thanking our Honorable Minister for Health, Honorable Umi Mwalimu, for getting time to join us despite your very busy schedule. This conference is coming at the time when we are celebrating the life of one of the Tanzanian's visionary leader, His Excellency late Benjamin William Mkapa, who was our third phase President of the United Republic of Tanzania and the founder of the Mkapa Foundation, who passed away 4 years ago on 23rd July 2020. For those who recall, we first had our very first National Human Resource for Health Conference in September 2013. And with time, we have observed at country level the existing number of health sector platforms that bring together stakeholders to discuss and deliberate on crucial matters related to improving health service delivery system, as well as our own individual health and society at large. Nevertheless, we strongly believe that it was of absence and it was of essence to revive this HRH conference, which will specifically deep dive into human resource for health issues so that we can learn, we can review, and exchange the level it deserves at the country level, as it requires very high political commitment, multi-sectoral approaches, and
Thank you very much, Dr. Ellen Mkonda, Chief Executive Officer, Benjamin Mkapa Foundation. I'd like to recognize the presence of Dr. Adelina Kimambo, Chairperson, Benjamin Mkapa Foundation, Ambassador Saidi Musa, Deputy Permanent Secretary, Ministry of Foreign Affairs and East Africa Cooperation, representative of Minister of State, President Office, Regional Administration, Local Government, Permanent Secretaries, members of diplomatic corps, media practitioners, and the stakeholders, including business community and non-state actors, distinguished participants, ladies and gentlemen, habari za asubuhi. To welcome each of you to the second Tanzania Human Resource for Health Conference organized by Benjamin Mkapa Foundation under the Mkapa Legal Summit 2024. Sorry, my voice is not okay. Today I was in Tanga for a political rally meeting. Until 8 p.m., I was attending my constituency in Tanga, but because we are discussing a very important matter relating to the health sector in Tanzania, which is health workforce, I thought I should be attending this meeting while we are going to have the official inauguration of the Mkapa Summit 2024 tomorrow. When you ask me as a Minister for Health, what are our key challenges in the health sector right now, I will mention two. One is human resource for health. Number two is about health financing, including facilitating affordability of healthcare services to Tanzanians. So your presence today here reflects a robust and to advancing our health sector and indeed to the broader national development agenda where health plays a pivotal role. Distinguished participants, ladies and gentlemen, today as we come together, we honor the extraordinary legacy of the late President Benjamin Mkapa, the former President of the United Republic of Tanzania. We all know that his leadership and steadfast commitment resource for health program have profoundly shaped our healthcare system. President Mkapa relentless, our maternal and child health initiatives have the multi-sectoral collaboration is a key accelerator to realize health outcomes. These improvements are not just statistics. They represent lives saved and communities strengthened. We have continued to improve our service level agreement with non-state actors, including but not limited to private sector, non-government organization, and faith-based organization, while we continue to inform our PPP framework, which is at the final stage of completion. Ladies and gentlemen, it is crucial to recognize our strength in the areas where we need improvement as we strive to build on our success and address the obstacles that remain. We have gathered a wealth of lessons as we pursue our partnership and implement sector priorities. Reflection to these lessons is essential to solidify our collaboration and achieving high-level impact. The insight gained from our experiences have underscored the transformative potential of a coordinated, multi-sectoral approach in strengthening health system and promoting community well-being across Tanzania. Ladies and gentlemen, today's agenda is designed to illuminate key areas where our partnership and multi-sectoral collaboration must focus to achieve a significant impact on health services to every Tanzania. You will explore a range of critical topics, that is health technology, climate change, private sector engagement, resilient community-based health program, and global health security, each of which plays a crucial role in shaping our national health strategy and ensuring the future prosperity of our health sector. All of these topics have critical implications to our human resource for health, from their training and development, utilization, motivation, and optimization. The detailed and noble discussions we are going to have for these 2 days will transform our human capital in the health sector that will meet our prioritized and evolving health needs, as well as response to international standards. And as we tackle these pressing issues, it is imperative that we strengthen our strategies and responses to uphold the health and safety of our people. Through focused dialogue and collaborative efforts, we can address these challenges heads-on and drive meaningful progress in our health sector. Ladies and gentlemen, these issues are central to the health and prosperity of our nation. Our discussion today will play a crucial role in shaping the strategic direction of our health policies and initiatives, and in building a resilient health workforce in the health sector that meets the dynamic, evolving, and comprehensive health needs. I encourage each of you to engage actively, share your expertise, and contribute your perspective. Your input is vital in refining our health strategic agenda and setting priorities that will drive meaningful progress. Allow me also to mention that this year we have already started an assignment to develop a health sector strategic plan 6 for year 2026 up to 2031. So we look also forward to get your inputs in shaping our health sector strategic plan for the next 5 years. We believe that through collaborative dialogue and informed discussion, we can also develop strategies that address critical human capital needs and other most pressing health challenges and capitalize on emerging opportunities. Ladies and gentlemen, we are all aware that one of our core values is ensuring equity in healthcare. Access to health insurance and universal health coverage are fundamental to our vision of an inclusive healthcare system. And since we are also celebrating Mkapa's life, I would also like to remind you that the National Health Insurance Fund was actually a legacy or an initiative of the late President Benjamin Mkapa, the former President of the United Republic of Tanzania. Today, we are very proud to note that through NHIF, 100 of Tanzanians have access to quality healthcare services because of President Mkapa's commitment and passion to improve access to quality and affordable healthcare services. We are committed to leave his legacy by ensuring that every Tanzania has access to a affordable healthcare system for everyone. Ladies and gentlemen, as we move forward, let us embrace constructive dialogue and collaboration. Your feedback and contribution, all those topics are essential as we work together to document our discussion and recommendation. Tomorrow, we are expecting to have the Prime Minister of the United Republic of Tanzania, whereby we will convene to consolidate our insight, which we are going to present to him on tomorrow, but also on 31st. We are expecting to have the top leadership of the country, whereby we look also forward to present your recommendations, input, and insight on how to advance our health sector in Tanzania. Distinguished participants, ladies and gentlemen, in closing, let us draw inspiration from the legacy of President Benjamin Mkapa and remain steadfast in our shared mission to improve the health and well-being of every Tanzania. Together, we have the opportunity to make a lasting impact and propel our health sector to new heights. Thank you very much for your dedication, your participation, and your unwavering commitment to our collective goals. Having said that, allow me now to say that the pre-session, this panel session for the National Human Resource for Health Conference is officially opened. Asanteni sana kwa kunisikiliza. May God bless Tanzania. May God bless you all. Thank you.
Distinguished participants, I believe our guest of honor deserves a bigger round of applause more than that. Tunashukuru sana. Thank you for that wonderful remark and really for making time this morning despite your pressed schedule. Honorable guest of honor, allow me now to briefly and quickly mention our esteemed sponsors, acknowledging their very, very valuable contribution to making the third summit a great success. These are the United Republic of Tanzania. Let's give a round of applause to the government of Tanzania for sponsoring this event. But also we got the support from the Revolutionary Government of Zanzibar. Let's give them a round of applause. We would like to thank NBC Bank. Let's give them a round of applause. USAID, let's continue to clap. Clouds Media, and thank you for covering this event, but Irish Aid, TTCL, Studio Red Communication, and Crown Media, we thank you all. Let's now clap for all our sponsors. Thank you very much. Honorable Minister, we're now moving on to the opening plenary, which for me, I would like to really call it a high-level plenary, which is going to set the tone for the two-day pre-summit on the National Human Resources for Health Conference. This plenary will address, among others, the two issues that you also mentioned on your remarks, which are of a major concern, human resources for health, but you also mentioned financing this sector. This high-level plenary will look onto the international cooperation and health system strengthening initiatives and will be moderated by Dr. Helen Mkondia, the BMF CEO. While we understand that you have a pressing commitment this morning, we'll allow you to kindly feel free when you want to exit the room as the plenary will be going on. As now, I will shortly invite Dr. Helen to come and take us through and engage our diverse panelists. Let me speak a little bit about her. Dr. Helen Mkondia, who is a medical doctor by profession, holds a master's degree in public health, but also she received an award of Honorary Doctorate of Science, DSc, honoris causa in 2023. This was conferred to her following a massive wide-ranging contribution and success in the health sector. And she's a renowned leader in the public health, bringing on the stage over 29 years of work experience. Dr. Helen boasts of a three-dimensional understanding of the Tanzania's health sector, with a rare blend of experiences from working with the government of the United Republic of Tanzania, but she's also worked with multilateral organization, UNFPA, and she's also worked in the non-governmental organization spaces. She's familiar and has been actively engaged in the national reforms of the health sector, local government and public sector in Tanzania, mainland, as well as in Zanzibar. She is renowned by providing stewardship in provision of employment of more than 6,000 professionals, health workers, and more than 7,000 community health workers serving across the country. We are totally proud to have Dr. Ellen moderate this session this morning, as she is also the chair of the Board of Trustees of the Muhimbili National Hospital of Tanzania. She has represented the non-state actor in various policy and strategic reforms in the country and at international health sector related dialogues with the governments, development partners, private sectors, and foundation. Honorable Minister, distinguished participant, ladies and gentlemen, let's put our hands together to Dr. Helen as she comes to the podium. Karibu sana.
Asante sana. Okay, so we're starting with our first open plenary session. Honorable Minister, just give a very brief introduction of the session with the reflection that many of us are aware that Tanzania has enjoyed historical relationships and cooperation with different countries globally, whether it's government to government or people to people cooperation. Moreover, we have continued strengthening our health diplomacy in tandem to the economic diplomacy, though I believe we still need to do more, especially on the former. In light of the above, today I'm very honored to moderate the first opening plenary session of panelists with diverse perspectives and rich expertise in diplomacy, economics, political, and health development. Without further ado, may I humbly welcome the following to the stage to assume their seats, starting with His Excellency Dr. Mpoki Ulusubisya. Karibu. He's a former ambassador of United Republic of Tanzania to Canada, who is currently serving at the Jakaya Kikwete Cardiac Institute as a senior medical consultant on anesthesia and critical care. He also served as our permanent secretary of the Ministry of Health in the past, where he provided oversight to the health sector reform. As a focused and passionate and strategic leader with more than 28, Dr. Mpoki is a medical doctor by profession with a master's degree in medicine in anesthesia and critical care, as well as holding his master's in business administration. He's also a visiting lecturer at Muhimbili University of Health Sciences and Herbert Kairuki Memorial University. Karibu, Dr. Mpoki. A round of applause for Mpoki. Thank you. Now we have His Excellency Makocha Moshe Tembele. That's our second panelist. He's the ambassador of the United Republic of Tanzania to Indonesia. Previously, he served as a personal assistant to the former president, His Excellency late Benjamin Mkapa, for over 6 years, before becoming the Director of Multilateral Cooperation in the Ministry of Foreign Affairs and East Africa Cooperation for 2 years. He was appointed as our ambassador in May 2021 and posted to Indonesia as our first resident ambassador in May 2022. His Excellency Tembele served as a coordinating member of the mediation team advisor to the second Burundi peace process under the former president of Tanzania, the late Mkapa, in his capacity as the East Africa Community Facilitator of the Inter-Burundi Peace Dialogue in 2016. His Excellency Tembele, prior to joining the public service, has had 9 years stint in the private sector. He's worked with the private sector. He holds a Bachelor's of Arts Economics and Master's of Arts degree in International Relations and a Master's of Advanced Studies Mediation in Peace Process. Karibu sana, Balozi Tembele. A round of applause for him, please. Finally, but not least, we are also honored to have His Excellency Togolani Mavura, who is our ambassador of the extraordinary and plenipotentiary of the United Republic of Tanzania to the Republic of Korea, a formidable champion for blue economy, public health, and climate change diplomacy. He's an experienced and grounded civil servant with hands-on experience in working in the presidency, diplomacy, public policy, and communication. He previously worked as an aide to the president, speechwriter, aide to the former president, Dr. Jakaya Mrisho Kikwete, and private secretary to the foreign minister. Through working with high-level political leadership, he acquired a broad understanding of global and regional processes and issues spanning from governance to global health, education to conflict management. He's also familiar with working with the United Nations, African Union, East Africa Community, and international development. Ambassador Togolani is a degree holder in Bachelor's of Arts, Political Science, and Public Administration, and is also a graduate of Master of Science in Leadership and Development, and also a UK Future Leadership Program Chevening Scholar from the King's College, London. Karibuni sana. A round of applause to this very distinguished panel. Okay, let me take my seat. All right, before I start this panel session, I'd like also to recognize His Excellency Manoj Verma, who's the Deputy High Commissioner from India. You're very much welcome. Thank you. So good morning. Good morning, Your Excellencies. I trust you're all doing well and in good health.
Indeed.
Sure. So I'll just go straight to my few questions, which would like to hear more from your end. We'll understand that Canada is among our largest bilateral donor here in Tanzania within the health sector. Providing significant support in the health system.
This has been a portfolio that has looked into addressing the inequitable distribution of health services delivery in the country. And a majority of the work that has been done through the President's administration and local government. Ideally, to make sure that services are provided that are effective, that are efficient, that are affordable. But at the same time, to ensure that people that suffer from diseases that can be prevented or treated are not left behind. So the whole essence of the Canadian government has been in looking in those things. Now, historically, there hasn't been any problem because there is usually a memorandum of understanding that is entered between those who give and those who receive. And so the work is along that chart. So that becomes the blueprint. However, the Department of Foreign Affairs, Trade and Development of the Government of Canada, through Global Affairs, which is the Ministry of Foreign Affairs, has gone out to get certain things done out of the basket fund framework to address specific issues that will not be included in the basket fund portfolio. So things like food security, things like education, women, children, youth outside of the umbrella that is covered by the Health Basket Fund, and providing capacity building to bridge the gap, depending on specific needs that are raised by the recipient countries. This is a dynamic process that gets reviewed from time to time, and in the process, improvements are done to make sure that what was left behind is included. But as a member of two major bodies in the region, the East African Community and SADC, the platform that Canadian government offers also allows for the region bodies to approach the government and support services that are in short funding through such bodies. So the SADC and the East African Cooperation. So in short, that is what is available from the Canadian government. But the Health Basket Fund ensured that there was improvement in service provision, improvement in collection of funds through incorporation of IT means of implementation, but there are also areas where they assisted us in infrastructure development. when we were building district hospitals and health centers, especially around the lake zone. A majority of the funding through UNFPA came from the Canadian government. There are also other non-state actors, I think, that have also played parts, but depending on the need. Like the United Nations High Commission for Refugees has benefited a lot from the Canadian government, and as a government, we oversee the implementation of such interventions.
Okay, thank you so much. Just one more question I wanted to hear from your end. We understand that the government of Canada, you've spoken about government of Canada, but we also have academic institutions from Canada, and some foundations have been providing financial and technical support in different aspects in the health sector and social welfare. Now, as we're moving towards achieving the universal health coverage for Tanzania, can you share your perspective where and what could be some win-win cooperation with Canada, that we can seize such opportunities? A few minutes.
Oh, thank you very much. The country of Canada is like a continent. It is 10 times the landmass area of Tanzania and more. It's 9.9 million square kilometers. It has 10 provinces and 3 territories. 90% of the population of Canada exists within 240 distance from the border of America to the north. So a vast part of that land is not inhabited by people. And their population as of this moment is 39 million. So when we look at such a country, there are many lessons that we can pick that can help us sell the agenda of universal health coverage, that we leave no one behind. Because of the vastness of the territory and the sparsely population that is distributed the way I've described, the 10% occupies places that we would find inhabitable and unreachable. But none in Canada suffers from unreasonable expenditure of resources to find health because of the principles that the government has put in place. Number one, their health insurance provides for people to join any. There are more than 19. And these provides access to necessary health services. The necessary health services are defined by the ministries of health in the provinces, because it's a federal government. So each province acts like a semi-autonomous entity. Subscribe the responsibility of each territory, each province, to incorporate and make that none is left behind. So the country of Tanzania has enjoyed enormous solutions by providing that have had long-standing relations with the universities in the country. MUHAS, for instance, School of Nursing was founded by a collaboration between Dalhousie University and MUHAS. Many opportunities, University of Toronto, University of Calgary, and many others, including University of British Columbia, which is including University of British Columbia, which is housed in Vancouver. Victoria University is another one, and there are many. I'm just remembering a few here that provide opportunities for training on aerially.
Okay.
But when it comes to meeting the needs of the patients, telemedicine or the digital health platform has become a very, very important intervention that provides quality services to people that otherwise would not have managed to reach them on time and respond to such needs as they come. Together with diseases that are emerging and those that are re-emerging, they're covered through that way, while they're keeping in tune with what the WHO offers as a guideline for the World Health.
Okay. Just want to build on that a little bit, on the telemedicine, and you were the former permanent secretary.
Yeah.
We also adopted similar program.
Yeah.
What do you think are the obstacles or the challenges that we're facing? And your views, very quick one before we proceed to Ambassador Makocha.
Well, I think we loved the title, but the price behind the implementation was a serious challenge. When UNESCO offered us an opportunity to try the system with Ololosokwan Health Center in Serengeti, It worked very well, but we never sustained it because our resources did not just measure the gap.
Okay. Asante sana. Okay, now we go to Ambassador Makocha, Your Excellency. We know you are ambassador in Indonesia for some time now. What are the major achievements which you have gathered from Indonesia health system that we can adopt in Tanzania? But also, if there are any shortfalls, what should we avoid? Karibu.
Thank you very much. And first, I would like to thank you for inviting me. I cannot claim to be an expert in public health, but at least in international cooperation, I know one or two. So at least I can comment on that. Now, let me start with just giving highlight of what Indonesia is, so that it can give you an idea of the enormity of the challenge, to build a strong health system. It's the largest archipelagic state with 17,000 islands, and the population is about 270 million people. Now imagine delivering healthcare to 270 million people who are spaced in 17,000 islands. It's quite a challenge. So they've had their own trials and tribulation in their attempt to provide health service to their people. And initially, because it's a federal government, so they decentralized the budgeting system for the health sector. They had a law where every province is required to use about 15% of their budget in the health sector. So they had the minimum spending on health sector. They had that legislation. But then the challenge was, to meet the thresholds because, of competing priorities. So it proved very difficulties. So the net result of that was there were serious inequities, in the provision of health services. So you will find some of the provinces are way ahead of the others, and in some other provinces are very far and remote. So reaching them was very difficult. So what they did is, of course, they enacted a new law now, which they require what is they call the performance-based budgeting system, and which was centralized. So the genesis of that is because they wanted at least to eliminate out-of-pocket consumption on health, and that improved a bit, and that we're talking about 2019. So, but one of the areas that I think we can take a lesson from them is that they also introduced a universal healthcare law in 2014, and they're quite successful in that. With 270 million people, they are covering about 215 million people, which is almost 81%. Of the people are covered with health insurance. Now they have their challenges in the sense of providing services to everyone, because as I said, it's a constellation of islands, and some of which are difficult to reach. So one of the key lessons that I think we can learn from, almost an oxymoron, if I say it's a difficult and it's an easy question. It's a difficult in the sense that you are asking me to wear his shoes. He was someone who was very introspective in his remarks. So it's a bit difficult to wear his shoes, but I will try. It's an easy one because you want me to give sort of like a conjecture, so there's no right or wrong. And what I'm going to do is, having worked for and under him for, you said actually to be precise, is 7 years, let me use two of his attributes that I think will inform my conjecture. The first one is that he was an internationalist. So he had a fair appreciation of what the international cooperation can do to help us as a developing nation, to meet our developmental aspirations. So he was an internationalist, so, as a developing country, we need to forge cooperation to help us to achieve our aspiration. Even in the implementation of the Vision 2050, we need to forge this cooperation. But the second attribute, and I think that is also very important, is that he was also a realist. A realist in the sense that he understood that there is no altruism in international cooperation. You know, we don't cooperate with each other for altruistic reasons. So everyone, that is to say, usually in international corporations, there's no such as free lunch or free dinner. So for him, you always have to be mindful to see where the elephant is stepping on, because for you, it's a matter of life and death. If you don't look at where the elephant is stepping on, you know, then he will trample on you and you will die. So the rabbits are us, the developing countries. So you might have a Vision 2050 and you might have programs that you think are implemented and that will help us to implement. But then you hit the geopolitics. You're told these programs are not you know, friendly, they're environmentally unfriendly, they're unsustainable and all that. So what we need to do is to develop our own domestic wherewithal to implement those products, and then we can forge cooperation to support where we fall short of our resources. And just as a final point, I think we all know that, for example, you know, the Julius Nyerere hydropower project.
Yes.
Everyone knows that was conceived during Mwalimu time, the idea, but the implementation was done during Magufuli. So in this I'm leaving as a food for thought for everyone to think for themselves. Imagine if we had implemented Mwalimu Nyerere hydroelectric power project then, and we were able to draw this 2,115 megawatts of electricity then, where would we have been, you know, in terms of the energy that was generated to help us with our development strategy? So it is very important to take stock of geopolitical dynamics, and then we should be able to see and find ways how we circumvent those dynamics. I think that is what he would say. Thank you very much.
Asante sana for the very thought-provoking views. A round of applause for him. So just want to wind up a little bit and then we proceed forward to the audience. Just be ready with your questions or comments. We'll give time for that. Now we go to Your Excellency, Ambassador Mavura. It is reported that Korea is the top 5 leading countries in the world that provides financial support, either through ODA or grants for the health sector globally. Understanding that risk
so far training of our people. Currently, there are 8 3-month training on health. But going forward, I would say we have not had a structured cooperation between our 2 countries on health. So far, it is health infrastructure. So going forward, the strategy should be now how do we, our 2 ministries of health engage and have a comprehensive agreement on how to cooperate. And I give this example because the country like Saudi Arabia, since 2012, have a dedicated program to train their people in Korea for a long-term plan. And we can do that as well. So we are working and already have a consultation with the Office of the Minister of Health to see if we can have some sort of an MOU before the end of this year. And that will open the door now for a more comprehensive relationship in terms of health. But there's another potential, which we have not explored, which is Korea NGOs as well. They're doing very well. So far, we have Africa Future Foundation, which is working at Mloganzila, and is the one who's supporting most of this training. But there's a lot of opportunity, and when you came to Korea, I introduced you to Korea Council Overseas NGOs, yes. And last month they were here, yes. And they visited you to do a mapping of a Tanzanian NGO CSO and see how well you can cooperate. They also have enough resources for this. So there's opportunity, there's more money, that's number 1. Second, we are in the priority list. Let me go first to this private sector thing. In Korea, you cannot tell the difference between a private and public facility. The lines are very, very blurred. And 72% of people are actually attended by private facilities. Government actually caters for only 28% of people. So it is largely dominated private sector. But again, many people attended to clinics, and they're attending to private clinics actually, owned by professional doctors, but also attending to universities, hospitals, which are also privately owned. And the largest hospitals in Korea, the top 5, none of them is government. Most of them are privately owned. The first one is Assad University, which is owned by Hyundai. And then you have a Samsung University, then you have a Korea University, which is private, and then you have Yonsei University, which is private. So it's not even a Muhimbili, even the Muhimbili is private. So because of that, private sector is important part of health care in Korea, and the government is working with them as partners, as equals. Thank you.
Okay, very interesting. Asante for those very honest views. I know we're running out of time. I just want to take a quick questions from the audience. You have 2 people. Show of hands, or they've put on the notes? Okay, we'll start with the lady, Karibu. And I tend to recognize her. Please, can she have a mic? Karibu Prudence. We can go on forever here, so yeah.
Thank you so much. Such a
Just keep it short.
Thank you.
And
Thank you
concise.
so
Thank
much. We have learned a lot from our dear brothers. My question is to Ambassador Togolani, and I was so pleased to hear about Tanzanians going to learn there. But my question is, why not an exchange, us having the tutors or professors from Korea to come to our colleges like the students, because I know the students will go. When they come back, they come to the same systems. Well, if someone comes from that system, can somehow help us to change our systems as well. So should not go to learn, but as well as have those professionals to come and have that kind of partnership. Thank you.
Thank you so much, Prudence. Another question? Let's just take some more questions. 2 more questions. I can't see show of hands. How much? Please, there's one there. And then the boss, Dr. Mliga, we start that with Professor. Karibu, you introduce and then proceed.
Thank you so much. My name is Dr. Matogoro from the University of Dodoma. And it's exciting to have the excellence sharing the experience. I would like to understand the extent of the adoption of technology, especially the emerging technology like artificial intelligence in the health sectors in those countries. Maybe we can get experience from those. Thank you so much.
Thank you so much. Next, Dr. Mliga. I hope you're taking notes of that.
Thank you very much, Dr. Mkondia. I'd like to ask Ambassador Togolani. It is very interesting that the health provision in Korea is very much privatized. And as for us, most of our health provision is carried out by the government. The challenge that I see there, which may not be, I don't know what the arrangements there are. How is the financing of the people who, some of them are very poor, and you know that private sector is usually profit driven. So how does the government of Korea ensure that the people, especially the poor, get access to health care provided by those private facilities? Thank you.
Thank you so much. Just, I'll give a special opportunity for a lady. If there's a lady who has a question. Please, Karibu. And feel free to use both languages, Swahili or English. Karibu. Okay, Mike.
Okay, thank you, Dr. Helen. My name is Marieta Mashimba, Health Administrator from JK Hospital. My question to Ambassador Togoran is, yes, is the collaboration of Tanzania and Korea on training, endorsement, and ensuring human resource for health skills. How do you strengthen training on private sector's human resource for health? Because the priority is given on to the government, but if we are going to strengthen quality of health care, we should make sure we strengthen public-private partnership as well.
Asante sana. Okay, so maybe we'll start straight with Ambassador Mavura Togolani, because most of the questions were channeled to you, but I'd like also to hear the views of other panelists as well, especially the technological issue. Karibu.
Asante. No, aye. Starting with Prudence. She wanted to understand why we talk only about sending our personnel to Korea and not the vice versa. I have two responses on this. The first one is already there are some Koreans who are coming here and working as volunteers. They're working under Koika program. And Loganzila is one of an example. We have, they're coming here for a period of time, from different specialities to work here. So that is in a small scale that we are doing. And that's why, and this is actually part of the infrastructural sort of cooperation. And that's why I say the answer going forward is having a comprehensive cooperation on health with Korea. So we don't have such a cooperation, that's why they're not coming. But they're available and they're actually going to other countries. So this is something we're trying to emulate. This is something that I'm working on. But next week, coming next week, I have a lecture of opportunity at MOHAS. And that's exactly the reasoning there. Trying to understand what they're doing, but again, trying to present to them opportunities abound in this area so that we can look for ways to cooperate. Koreans are ready and doing that a lot, especially in Asia, but they're doing less in Africa. And to me, partly is because for a longer time, I mean, whether it's our diplomacy, even our sector of health, it has been much more Western. We are focused much more on Europeans and Europe and America. Simple. We didn't turn to this side. This is I'm trying to say people. I mean, there's also another part of the world this side. So this is where we are going, and I see a lot of opportunity in this area. They are more than ready. Their government is financing a lot of the people to go out. They have a lot of retirees in Korea who are still healthy. They're living up to 86 years. They wish to go out under programs like that, but we need to have an embracing hands for them. So that's to you. To Dr. Matogoro, I should also pass on that. Strangely, in Korea, there's a lot of uptake technology in terms of diagnostics. In diagnostics area, technology is widely used. In the health information system, it's digitalized fully, widely used. And they have a culture that I like of having a shared infrastructure. The government put an infrastructure which can be shared by private sector and government sector. So you don't have to have your own health infrastructure system and then another hospital has theirs, another hospital has theirs, because the entry becomes very expensive if each hospital or each healthcare facility has to put its own infrastructure. So the government put the common infrastructure and the rest get access to it. So they're doing that very well. Telemedicine is something that they're not, the Korean Medical Association, the doctors, are not in favor of this. Because of course, for them, there are plenty of doctors and plenty of clinics, accessibility is very close, and they want people to come to be treated by them. So they are not very much in favor of telemedicine in Korea. The government is trying to move to that side, and during the COVID, it tried a lot to push that, but the Doctor Association, they are very adamant about it. And the Korean Medical Association and Korea Hospital Owner Association are very powerful institutions in terms of shaping what the government can do. So the government in Korea, especially in the health sector, doesn't have that much say on its own. It has to negotiate with its parties. In terms of, I think Dr. Mkonyi, if I'm not mistaken, asked about the financing.
It's Dr. Mliga.
Mliga.
Yes.
Mliga, about financing. Korea also is having universal health care, UHC. It's 100% coverage on the health insurance. Right? Everybody is covered regardless. And they're using pension system, which is covering for everyone, but the government also offers subsidies to that. But Korea is a capitalist country, but when it comes to health, it's a very socialist country. Yes, the government is trying that at all the time, the cost of health is not skyrocketing that much. So healthcare is more of a service than a profit business. There's not about high margin, but it's a question of volume. So it's more of a volume rather than the high business. Of course, the consultation fees, for instance, are very low, but they capitalize on things like annual health checkup and other areas, cosmetic medicines and other type of those kind of services. So that should not be a problem. But another factor, which I think it's important to talk when we talk about health in this country, is education.
Yes.
We usually take health as independent from education. So Korean public is very educated. Average education is diploma. So what does it mean? A person who is more educated takes good care of health, follow much on the health directives. So people also don't fall sick easily and don't have to use these expenses every now and then.
Yeah.
But also in the insurance system, they've made it in a way that is not cover you 100% all the time. So you pay, government will pay for like 85, you have to pay for at least 15%. And the idea when I asked, they said, if you make it free, people abuse it. Somebody having a headache in the morning and have a stomachache in the afternoon goes to those 2 or 3 times. So you have to feel the pinch of paying a bit out of it so that you'll be responsible in how you're using your insurance. So this is what I'm saying. In terms of Dr. Mashiba, collaboration, not doctor, inshallah utakuwa. In terms of private sector, I would say again, I said as in Korea, you don't see a difference between a doctor in private sector and doctor in public sector. Government cater, for them, the important thing is true north. Whether you're in private, whether you're government, you unahudumia wananchi, you're just attending people. So, of course, it's unfortunate that private facilities in Tanzania will not want to train their people and they expect the government to do it. But fine, the government should do it anyway, if possible, because at the end of the day, the people who are saved are Tanzanians, whether saved in private or public facilities. So what are they doing? To them, they don't discriminate. You have funds for that. And I think what we can do is a question now. When we are not talking about cooperation with Korea on health, in our MOU, it is up to us, the government side, to decide whether we are going to, we open this to all, whether you are in private or you are in government. Like Samia scholarship, I think is also not restricted, right?
Yes. Yes.
Thank you.
Thank you so much, Welles Mavura. Maybe I just want to hear from Dr. Mpoki, Ambassador Mpoki. What's your view in terms of the PPP, private sector engagement?
I think it's one of the key interventions that can leverage available resources in bridging the gap, especially when it comes to funding. The infrastructure available, the playing field, and the consumption is readily available for provision of quality services that are affordable. Now that affordability is quote unquote, because quality behind it will determine what can be done. We are running the same race. We cannot entertain unproductive competition. If our nation is sick, the people of this country deserve the very best from the health experts, whether they are privately positioned or they are in the public sector. And so we just need to ask for a field that is going to be regulated in a sustainable way so that people who invest don't end up losing, because that is going to be a disincentive for them to be engaged. And this happens everywhere around the world. With health insurance, companies that come, they could play a very, very pivotal role in ensuring that funding is not a limiting factor preventing our people from the catastrophic expenditures. Now, the lady who inquired about the training,
Yes.
I think it's a double-edged sword. In the past, so many people were privileged to go abroad, they never came back. But we are seeing a majority of the people now training outside the country coming back to offer services. India is such an example of the countries that are benefiting a lot from the citizens that acquired knowledge abroad and they went back home and established world-class institutions where medical tourism is blooming. But we also have opportunities where entities from countries that are more developed than ours wanting to collaborate with our people. Last month, or early part of this month, the MDRIM is an entity in Canada that came to MUHAS. And they took part in innovation co-creation workshop that was run by the university. This is going to form a building block for the implementation of digital health in the country. So that, like Muimbele University is already placing in place mechanisms that will help our people to train, and once they graduate, they're going to employ what they learn in transforming the healthcare space. On the artificial intelligence, this is a very, very broad question. Yeah. And I can't pretend that I'll have the answers to cover a country that is as big as Canada is. But there are a few things that I came across, and the first one is on forecasting population needs to inform planning. That is an artificially intelligent, motivated work. Identifying population groups with optimal needs that are not being met. The inclusion of populations that have been left behind for a long time, the Inuits, the First Nations, and those kind of people, is done by artificial intelligence, and then integrating analytics and digital tools with electronic health records. On the consumption, on the planning, on the transformation, but also on the design for better health commodities, be they medicines or devices to help solve patients' problems in the nation. All these draw a lot from the artificial intelligence. That is as far as the health sector is concerned. Okay. But out there, you talk about the Havilland, Canada, you know, the Bombardier. Yeah. The work that is being done there is done by robots, which is a product of artificial intelligence. Global aircrafts, these are business jets. The parent company of what we fly in now employs the same. Airbus industry does the same thing. When you talk about the trains, you talk about the signaling systems, because trains in the world now, especially the city, for commuter trains do not have drivers. What runs those systems is artificial intelligence that tells the equipment to stop at a given station, the doors open, and when everybody has embarked, the doors close artificially. Thank you. So I think the sky is the limit.
Thank you so much, Belazimpoki. And I know we'll be having some concurrent sessions today, which were related to artificial intelligence and transformational technology, but also issues of PPP models. So please don't miss those parallel sessions. Final Ambassador Makocha, please just give you a few remarks regarding the whole aspects on technology. And because you mentioned Indonesia has a very constructive and advanced digital healthcare. Please.
Yes, thank you very much. You know, moderates, I have an advantage here. I'm sandwiched by the ambassadors from developed countries, and I'm the only one from developing countries, so I can take refuge on that, because Indonesia is only coming out of age recently, about 10 years ago. Okay. But they're doing very well. So I think I'll only comment on the aspect of artificial intelligence. You know, because as I said earlier, yeah, for them, the sheer size and the population made it very important to have digital solutions to healthcare. Otherwise, they wouldn't have been able to reach to all their citizenry everywhere. So that's why, contrary to what my colleague Ambassador Togolani has said, for them they embrace very much telehealth, because they can reach to areas where people cannot access hospital care. So the comprehensive digital health blueprint has three aspects. It has, the digital health records to manage a deluge of data that they have. But also the second component is telehealth, and the third component is artificial intelligence. Now, one remark I wanted to say, and which it dovetails very well with what I said about Mkapa, is that Indonesians, they want to develop everything themselves, and then they only go out to seek support when there is a need to. So I can tell you that all these digital systems that they're developing themselves. And if you remember when the president of Indonesia came here for a state visit on August 22nd last year, we signed a memorandum of understanding with the Ministry of Health here. One of the components within that memorandum of understanding was on digitization of the health sector. They were ready to support us in the training on how to digitize the health sector, and I think that will help a lot. So to answer that question, I said artificial intelligence is one of the integral component of the digitization initiative that Indonesia is taking, and they're ready to share it with us, and it's actually part of the memorandum of understanding that we signed between us and them. Thank you very much.
Thank you very much. Just before we wind up, 1 minute for each one of you. Can we start with Ambassador Mavura, because we just need to wind up this session. It was quite interesting. 1 minute. Yeah.
Just 3 minutes. You're not going to solve the HRH, human resource for health problem. So we should not be frustrated, where we are. There's more we can do. It's a moving target, and we should be able to be agile. Thank you.
Thank you so much, Balozi Mavura. 1 minute, Ambassador Makocha, Karibu.
I'll just give a one-liner. Strengthening of the health system, to where I think, and most will agree with me, is predominantly a national issue. And I think that is where we should hedge our bets. And if there's one area that we can learn, the ownership of the health system strengthening, I think, is Indonesia, because, they guard that very, very jealously, because, they understand their own dynamics in the health system, and they therefore very jealously lead the process of the health system strengthening. And I think we can learn from them on that.
Asante sana. Makofi kwake. Please, my brother.
In the year 2018, the Ministry of Health drew a national surgical obstetric anesthesia plan for the country and costed it.
Yes.
We need to do a similar thing for the human resource for health, without forgetting that what we are doing today cannot answer questions that will exist 10 years down the line. So that must be factored in, without forgetting to factor for those that retire, for those that die, and for those that move to other places for pastures that are not as exist in the country. But also, we have to remember that as we train, we impart experts with knowledge and skills, but they need cross-fertilization from places that offer better. So exchange program must be part and parcel of specialized and super specialized training if we are going to see the dawn of tomorrow in health sector. Thank you very much.
Asante sana, Balozi Mpoki. So just to wind up, what I'm taking up as key home messages, which we need to take here, is we need to invest on health diplomacy. And I'm glad we have our Deputy PS here from Ministry of Foreign Affairs and East Africa Cooperation. So we should explore more and more, have more MOUs between the Ministry of Health. But we are also realizing that digitalization of our health services and system is of paramount importance. It's more of emphasizing on that area. I really like the whole idea you mentioned about the performance-based budgeting system, which is coming from Indonesia. That's a take-home message. And of course, we realize HRH crisis is not unique only for Tanzania or developing countries. Even the developed countries have their own challenges, which they've been addressing on human resource for health. Your honorable ambassadors, I highly acknowledge your presence, your views, your time, your thoughts, and great highlights that you've given us today. Asanteni sana. Asante. Thank you very much. And thanks to the audience, too, for the constructive questions.
Ladies and gentlemen, let's give them a big round of applause. Before you get on off the stage, please let's have a group picture. Tony, please come back. Mheshimiwa Balozi, please come back. Mnisamehe nimemwita Tony, Mheshimiwa Balozi. We come back. Tumetoka mbali kidogo na Mheshimiwa Balozi. Naomba tuwapigie makofi once again. Thank you so much. A lot needs to be done, but also, Dr. Helen, allow me to add. Safari, ukitaka uende mbali, we have an adage in Africa. If you want to go far, you ought to hold someone's hand and go together. But if you want to go fast, you can go alone. Kwa hiyo, the private sector, the international community, we all have work to do towards advancing HRH, but also what the minister had mentioned, financing for the sector. Tunashukuru sana the session for bringing that up. So we are now going on to parallel session. I have three very important announcements to make before we break. Announcement number one is Mkapa Fellows, all Mkapa Fellows. As soon as we get out of this room right now in the next 2 minutes after I finish my announcements, please, as you exit that door on the right-hand side is Mkomazi Hall. Let's meet there for a brief announcement. Scholar has some important information to share with us. All Mkapa Fellows, Mkomazi Hall, immediately after my announcements. Number two, we're going on to parallel sessions, which I will shortly mention about, but we shall reconvene here at 2:10. Saa 8 na dakika 10, naomba wote turudi hapa. There's a very interesting session that will be going on from 2:10 onwards. Most of us in our spaces have issues, but we hardly have time to meet with the employers, the people from the Ministry of Health, the people from the President's Office, regional administration, and local government. So they will be here, and they would like to hear what issues we have or what issues we face. Meet the employers, the session that will start at 2:10, and we should not miss that session. We are going to have a quick, about 10-15 minutes break immediately after I finish the announcements. So tea is served especially for those who missed tea in the morning. Sorry for coming late. Please come early tomorrow. But right on the first floor, this is ground floor, okay, so this is the first floor. Right on the second floor is Meru, and on the third floor is Kilimanjaro. Tea is served there. Please grab your tea quickly, and let's go on to the breakaway at exactly 11:25. The sessions in the breakaway will start at exactly 11:30. So we have about 25 minutes or 20 minutes to grab something quickly. Now, for those who do not have the program agenda, the session that will be ongoing here at exactly 11:25 will be looking onto the private sector partnership models through multi-sectoral approaches to enhance domestic financing for HRH development, and motivation. Okay, so the issues of the private sector will be conducted here, and Chief Executive of Association of Private Health Facilities in Tanzania, Dr. Samuel Ogilo. Are you with us already? Dr. Ogilo is right at the back. He will be moderating this session, and we have very good speakers. We have Dr. Harry Marwa from Farm Access. We have Mr. Jean Pels from USA Tanzania. We have Elise Lang from USA Tanzania. Mr. Lusaggio Ndagile from the Assistant Director of Planning and Budgeting, very important. But we also have Ms. Brenda Msangi from CCBRT. They will be in this room at exactly 11:25 to take us through PPP. The second session, parallel session, will take place at Ruaha, okay? As you exit this hall on your far left, that's Ruaha, and they'll be looking onto the HRH optimization, performance, and productivity towards universal health insurance, leverages from public and private health facilities. This will be moderated by Dr. Josephine Kimario, my dear sister, the Deputy Chief Executive Officer of the Zanzibar Presidential Delivery Bureau. She is with us. Dr. Josephine, just shake your there at the back. Why are you all seated at the back? except for, of course, Jumanne Mtambalika, who is seated at the front. So the session will be at RUA, looking onto the HRH, optimization, performance, and productivity towards universal health insurance. In order for us to achieve universal health coverage, these are the issues we're going to discuss on this session at exactly 11:25. The final parallel session will be looking onto human resources for health in transformational technological advancement, including artificial intelligence in the health sector. AI in the health sector. This will be moderated by Jumanne Mtambalike of Sahara Ventures, is with us at the front. Happy to see you. But the session will have Mr. Khatib Buyu, Head of ICT Ministry of Health, Zanzibar, Dr. Jabera Matogoro, lecturer at the University of Dodoma, and Ms. Suna Salum, the CEO for Office D-Lab, the CEO for D-Lab. They will be at Mikumi on the first floor. Ruaha will have Jumanne Shabani Dosa, Human Resources Coordinator and Government Liaison Manager from the Aga Khan Hospital. Gaudencia Mboya from the Gaudencia is the District Health Secretary for Dar es Salaam, and Zainab Kutengeza, Director of Performance Contracting Division at POPSM GG. So, distinguished participants, Mkapa Fellows, Mkomazi, will reconvene at 2:10. Breakaways, as I've mentioned, lunch will be at Meru and Kilimanjaro, so on the first floor and the second floor. I wish you all the very best. Let's now all get up and proceed to, for those having tea breaks, if not, proceed into the respective breakaway sessions. Karibuni sana na niwatakie majadiliano mema. Asante. Background.